Good afternoon. I'm Dr. Raghava Dutt, Director and Chief of Spine Surgery at Udai Omni Hospital. Today, we are discussing a little bit about what causes neck pain and how common it is amongst the population in general, and how to get better or how to control neck pain. And also, we are here to take some questions from you regarding surgeries and how often they are required, how safe they are, etc. Now, neck pain is very common, and today, as we always say, almost 80 to 90% of population suffers from neck pain, which would force them to go to a spine specialist or an orthopedic surgeon. Now, this is because the incidence of these pains is increasing rapidly all over the world. It's not only in India, but all over the world. And these pains are often debilitating and usually affect the most productive age groups. So that's between, say, the ages of mid 20s to mid 50s, and when people are at their prime working and taking up various tasks in their occupations and also taking care of their families. So today, this was the situation till about 10 years ago. But today, because of the use of a lot of electronic devices, even children are coming to us with neck pains. And the elderly, because of a lot of degeneration, that is because of wear and tear in the neck, they also come to us with neck pains. And that is the reason why this does not leave any age. So from children to elderly population, they suffer from these problems. Now, for a healthy neck, what should you do? If you're a diabetic, it's very important that you control your diabetes. If your lipid profiles are elevated, for example, the triglycerides, if they're elevated, you must make sure that the lipid profiles are under good control, most probably by dietary controls. If you're overweight, you must reduce the weight and you must exercise regularly. This is extremely important because most times the neck pain is due to mechanical reasons. That is because of the wear and tear. In the neck, we have lots of bones, and in between the bones, we have these rubbers, what we call discs. Now, these discs wear out, and we develop spondylitic changes, wear and tear. This happens between the bones, as amongst the bones, as well as the discs or rubbers between these bones. So these discs, they give us the cushioning so that when we bend our neck, it's actually, as I was telling somebody just the other day, spine is wrong word. Or we say reed ki haddi or venemuka. That is wrong because it's multiple bones. It's like a bicycle chain, one on top of the other. So all these bones, when if it is one bone, we can't bend our neck, we can't twist our neck, we can't rotate our neck. Because of these multiple bones and the disc, human beings can bend their neck in so many directions. Now, why do we get these pains? That is another question. The very fact that we are born as human beings. Now, for example, most animals, they walk on four legs, and human beings have adopted an erect posture. Because of that, there's a tremendous strain on the neck. And with today, everybody is in front of a computer. So it's natural tendency for human beings to, when we work at office or at home, to bend forward and look at our computer and our screens. And that throws a lot of load on the neck. And we have seen this again with the use of gadgets like cell phones. So people who are on the cell phone morning till night attending to their office work or business, they're also at risk of developing neck pains. So people who have to use a lot of cell phone for their work should always use earphones or earplugs so that, or use speakerphone so that the phone is kept away from them and then you can talk to or address your business concerns by keeping the phone at one place so that your neck is not unduly bent to a side, right or left, for hours together. So that is not good at all. Again, the same thing with laptops. A lot of IT people, personnel working for banks, education institutions, and the financial institutions, stock exchanges. A lot of people use these laptops, and these are not very good because it's human tendency again to bend forward and type. So that will, if you are using the laptop for hours and hours, that will cause a lot of strain on the neck. So when you use a laptop, it should be at eye level, and the center of the screen should be at the middle, at the center of your eye should be, vision should be at the center of the screen. So you must adjust that. Even better would be to use a standing desk. So if you have a standing desk when you're using a laptop, so that the laptop is at a at the correct level, and if you connect your laptop to a big monitor, you can sit and stand and sit and stand and work. So these are simple things that you need to do. Again, very important aspect that people forget is this obesity and sedentary lifestyles. As long as we don't exercise, we cannot have a healthy spine. So, what exercise should we do? That is a question. You can do any exercise. There is nothing like a good exercise or a bad exercise. As long as that exercise is not increasing neck pain, there is no problem. So, for example, you can walk. Swimming is very good. So is yoga for neck pains, and so is various sporting activities like tennis and football and cricket, and all these are okay as long as when you play those games you are not getting neck pain. So you have to see which exercise suits our neck, and then you should do them because each individual is different. There's a question here from Simran. Hi doctor, how do I know if my neck pain is serious? Now, this is a common question. People are too worried because of reading on Google, is this cancer? Is this something else? Will I get paralyzed? These are all rare things. Always remember, rare things are rare. So, how do you know your neck pain is serious? There are some red flags, as we say. If you are getting severe pain along the hands or upper limbs, then I wouldn't call it serious, but that is something you should be taking advice from your family physician or your spine surgeons. That's very important. So it is not just neck pain. Pain going along the arms is a situation when you should visit your doctors. If you're getting severe giddiness associated with your neck pain, see, suddenly you get up, you get this reeling sensation, etc., then you must consult your doctor. That's very important. If there is any change in handwriting, for example, your handwriting is not as good as you were writing before, or if you are writing but writing has become clumsy, which was good before, that is certainly a sign when you should go and visit your doctors. The same thing, if you're not able to button or unbutton your shirt, you must consult your doctors. So, severe giddiness, severe pain along the hands or legs, unsteady gait, that means along with neck pain, you're losing balance. For example, you're not very steady, your legs and hands are a bit stiff, then you must consult doctors. These are all some of the serious issues that would require a visit to your doctor and get properly investigated. Again, for example, if you're dropping things from your hand, you're not able to hold a cup, or you're not able to hold a glass of water, and or you're not able to hold your keys, then those are the signs that you should certainly consult a doctor and get yourself investigated. Pain, of course, if the pain is very severe, it is a serious situation. But that pain, mostly more than pain, it is these signs that you should be careful about. Is neck pain unavoidable as you age? This is a question from Shweta Saha. No, nothing is unavoidable. We all suffer from pains as we age because of aging itself. As we age, our bodies deteriorate. So your neck cannot be as healthy as when you are at 80, for example, or at 90. That doesn't mean that you have to suffer from neck pain or back pain. There are millions of human beings who are in their 70s and 80s and who do not experience neck pain at all. This again is because of your habits, the way you lead your life, etc. So that is very important. For example, if you are a smoker, your incidence of degeneration is much higher. That means your degeneration gets accelerated if you are a smoker. So that is one thing again you have to be careful. So if you are a smoker and if you use tobacco in any form, that has to be stopped right away. So people who stop smoking again will have a healthy neck and healthy spine. And if you're an uncontrolled diabetic, then you have to get your sugars under control. And same thing, if your thyroid is high or low, the thyroid hormones, then those need to be addressed. Likewise, there are many conditions that need to be, as I just mentioned about lipid profiles, and these are very important. And again, vitamin D, if your vitamin D is low, then your bones become weak. So people at any age who have a healthy lifestyle, non-smokers, and people who eat in moderation, get their other metabolic conditions or disorders under control, they have a good chance of not suffering from undue neck pain in the later ages of life. Now, another question from Shrestha Roy. Can neck pain be an early indicator of nerve damage in neck? No. The answer to this is again yes and no. Not every neck pain is an indicator of nerve damage. This is again, all this information comes from Google. Please remember that a lot of information that you read in Google is totally, utterly wrong, confusing, misleading, and not accurate, and again, not scientifically supported by spine surgeons associations all over the world. So every neck pain is not an indicator of nerve damage. You may get neck pain because there are lots of joints in the neck that can cause neck pain. I mentioned about the discs. Can I have that, please? So we have a lot of discs in between the bones, thanks. As you can see here from the side, see we have these bones like this, one on top of the other in the spine, and we have these rubbers. So these rubbers can wear out, and that can cause neck pain. And sometimes the joints at the back between the bones, those can wear out, and that can cause neck pain. These are the nerves that are coming out. Sometimes they can get compressed. So that also can cause neck pain, but that does not mean that the nerves are damaged. So slight pressure on the nerve does not mean that there is a damage to the nerve itself. And again, there are huge number of muscles, both in the front as well as in the back of our neck. There are lots of muscles inside and on the sides and on the back. All these muscles can experience, there can be a sprain, and that can cause neck pain. So you have a variety of reasons that cause these problems, and not everyone causes damage to the nerves. Mr. Vishal Sharma, can you suggest some exercise for immediate relief from neck pain caused due to poor posture? Well, first I'll address poor posture. Now, there is nothing like sitting straight or sitting correctly. The very fact that we sit for long hours will make our posture of the spine go for a toss. So please don't sit. That's very important. Any exercise that you do for poor posture is not going to work, because again, when you come back to that posture, the pain is going to come back again. So it's very important to avoid a poor posture. How do you do that? Now, every doctor, every physiotherapist, elderly people, teachers, our parents, when we are young, they all tell us to sit straight and sit straight and sit straight. To my knowledge, no human being can sit straight unless you are doing some meditation or something. So you cannot sit straight, and it's natural tendency to bend forwards. So what you have to do is to get up. Don't sit, and don't sit. Keep getting up. Automatically, our posture becomes correct. And as I told you just now, you must have the monitors at the center and avoid using small gadgets. Now, simple stretches are very important for neck pain. So, what you have to do is every 20 minutes take a break. Every 20 minutes, keep getting up. And if you have a big monitor, if you have to concentrate on your numbers or your data or something or your programming, you can see from a distance. If it's a small laptop, you can't go near, you can't see the data on the computer. So except when you're traveling or you have a conference or there's some meeting, avoid using small monitors and have big monitors. That's the one thing. Keep getting up every 20 minutes, and you should do all these stretches. Keep your back straight and look up, right up. And again, you sit in front of a mirror or in front of a screen and touch your ear to the shoulder. Now, if I do this, gently, slowly, you have to bend your neck so that slowly the ear touches your shoulder. So keep your shoulder straight and gently bend your neck to one side and make sure that it touches the shoulder gently, a bit more, a bit more, a bit more, like that. And both sides, you should do these stretches. That's one thing. And then you should look back. So keep your body straight, turn towards your left side, hold for a few minutes, few seconds, then slowly turn to your right side and hold for a few seconds, like that. So it should give a bit of stretch to your neck. And again, look up and look down, like that. And put your hand to the front of your forehead and press against the hand so that your muscles become taut. And these exercises are very important. So keep your head straight and press on the front. Again, you have to do that. Keep your hands back and press behind so that the muscles become strong. And same thing you should do. You should keep your head straight and press against your hand and count 10. And take out your hand, keep your head straight, don't bend it to one side or the other, and then bend against the hand, looking straight. 1, 2, 3, 4, 5, like that, count 10. So looking up, looking down, turning to right side, turning to left side, looking behind, right behind without turning the body, and to other side. So these are some of the basic exercises you should do. There are a lot many more than what I've shown you today, and it's very important that you go to your physiotherapist who is close to your office or workplace, sit with him and learn these exercises. And you do these exercises in front of the physio so that they will guide you if you are not doing these exercises properly. So simple exercises will go a long way in preventing and suffering from neck pain. And as I said, there is no excuse for a poor posture. So you have to get up and then keep moving. That's very important. Can arthritis be a cause of neck pain? Yes, it is. There are very many types of arthritis. First, the doctor has to differentiate between a degenerative arthritis, that is, arthritis due to wear and tear, arthritis due to mechanical reasons, and arthritis due to various rheumatological conditions. For example, if you have psoriasis, a skin condition, it can affect your spine. If you have rheumatological conditions like rheumatoid arthritis, there are many varieties in these that can affect your spine. If your uric acid is high, that can affect your spine. Likewise, there are very many conditions. There are a lot of collagen disorders that affect your spine and the joints later on. There are a lot of connective tissue disorders that can affect your spine. So, yes, arthritis causes neck pain. And first, you have the doctor who is treating you should differentiate and identify which type of arthritis that you have. If it is degenerative wear and tear arthritis, good physiotherapy, exercise programs, as I was mentioning, healthy lifestyles will cure a lot of patients. If it is a rheumatological condition such as rheumatoid arthritis or systemic lupus erythematosus or many other conditions that can affect various joints of our bodies or skin disorders, then your rheumatologist or your physician will advise you about neck pain and about medication for your arthritis as well as physical therapy, and then you can go ahead and take treatment along with physiotherapy that will give you a good result. How can a chiropractor relieve neck pain? Right. It's not chiropractor or physiotherapist or whoever. There are very many modalities of relieving neck pain. There are two modalities. One is medication. So depending on the condition of your neck pain, you should take medication. This medication, if it is due to mechanical pain, suppose somebody has severe neck pain, he can take painkillers for a few days. But obviously, you cannot take painkillers forever, not only because of side effects, but that's not the correct way of treating neck issues. That is one thing. So any medication, painkillers, etc., once in a while perhaps is okay. And you must make sure that your kidneys are functioning well, your liver is okay, and your doctor will give you those tablets for a few days. Now, if you have rheumatological conditions, you need different types of drugs. Those drugs are totally different from painkillers. So simply by going to a chiropractor or a physiotherapist without a diagnosis of what exactly is causing the neck pain, that is not going to help. Because if you have, for example, rheumatoid arthritis, it needs to be treated. If you have psoriatic arthritis, it needs to be treated. If you have calcium pyrophosphate disease, that has to be treated. Once that is done, then the doctor will guide you to go to a physiotherapist, and then they will do various modalities from deep tissue massages to ultrasound to lasers to interferential therapies to the thing called TENS to taping, kinesio taping that they do for the neck, and many more techniques are there, and each person will have a different technique will help. There is nothing like a standardized physiotherapy, so that is what you should be doing. So first get the diagnosis cleared, ask the doctor, your family doctor, where you should go, and once they advise, then your treating therapist can certainly help you. Yeah, that's what you should do. Does sleeping on a specific mattress or pillow affect the severity of neck pain? Uh, this is very important. Doctors, as well as some physiotherapists, tell you to sleep in a particular position. Please don't do that. The worst thing that can happen to a human being in sleeping in a particular position is what we call sleep deprivation. That is very bad for human beings. For your metabolism, it is not good. For your biological rhythms, it is not good. And for your neck, it is not good. So you sleep in whichever way you are comfortable. There is nothing like sleeping one way or the other way. If you're comfortable sleeping on right side, do it. Sleeping on left side is comfortable, do it. Just sleep whichever way is comfortable. Number one. Do not go by advertisements. Spine surgeons do not recommend mattresses. Do not believe everything that you need on the net in advertisements. Our body does not talk about promoting companies. We don't do that. We are forbidden from doing that as doctors, ethical doctors. Always use a firm mattress. A mattress should not be too soft. A mattress should not be too hard. It should be firm. It should be like sleeping on a nice carpet on the floor. You get a nice feeling. It's not too hard, it's not too soft. So that's what you should do. Use a thin pillow. It should not be again too thick. Don't use multiple pillows. And again, there are variety of pillows available in the market. See what is comfortable for you. So a mattress with coherent foam, which is a firm mattress, is that you can use. It should be comfortable. It shouldn't be too soft. It should not be too springy and it should not be too hard. And don't watch movies or news or Netflix, etc., while sleeping in bed. Do not do any computing work while you're sleeping on your bed, and to avoid use of tablets and cell phones while you're in bed. These are some things that you should avoid. Perhaps once in a while it's okay, but when you're watching television, etc., while lying down, we get carried away, and for hours end on, we see a football match, for example, and that is not good. So always sit straight and watch your screens. That's always better than lying on in the bed. So a firm mattress, which is not too hard, not too soft, a firm pillow is that's all you need for a good sleep. Mr. Ali Khan, if a person is suffering from osteoporosis, should they be concerned about having severe neck pain? This osteoporosis means weakness of the bones. This usually affects people in their older age groups. Osteoporosis, by definition, weakens the bones. Once the bone becomes weak, then that is not a strong bone that won't support your neck. So first you have to address osteoporosis. Again, there is a misconception amongst doctors as well as amongst patients that they think that by taking a calcium tablets, their bones will become strong. This is not true completely, because most of Indians, we suffer from about 600 milligrams of deficiency of calcium in our diets. And the treatment for osteoporosis is again brisk walks, exercises, and for young persons to prevent osteoporosis, skipping, jumping, running, brisk walking. These are what young people should do. If you have neck pain, obviously you cannot jump and you cannot skip, but once the pain subsides, you must go for a good 5 to 6 kilometer walks every day. And exposed to sunlight, get your osteoporosis addressed by your physicians. Every morning, all of us should expose ourselves to sunlight. If it's a bit cloudy, maybe perhaps about half an hour. And in peak summer, about 10 minutes, you must expose yourself to sunlight. So calcium-rich food is what I recommend. Good protein in our diets, lots of exercises. That will prevent wear and tear of our neck bones and this, and also strengthen our bones and prevent deterioration secondary to osteoporosis. Again, it depends on how severe the osteoporosis is. Please consult your family physicians, and that would be the best thing to do. What qualities should I seek when choosing a physical therapist to help with my neck pain? Somali Bhattacharya, that's a good question. Well, these are the days of advertisement. There's no one can tell who is good or who is bad. The best people or best way to know is word of mouth. You should go to a physical therapist who has time, who can talk to you, because most doctors do not have sufficient time to spend with patients. Physical therapists should talk to you, address your problem, understand your problem, do therapy for a few days or few weeks, give you exercise programs, and guide you for a healthy lifestyle, for a healthy neck. This is very important. So choose somebody who is knowledgeable. Your friends and relatives will certainly tell you who is good, and then who has time to solve your problem. That's what you should do. Do desk jobs cause neck pains? Yes, they do. Human beings are not supposed to sit. So you must keep moving. Desk jobs are notorious for causing neck pains and back pains. And today, all of us do mostly sit at one place. So that is bad. So that is why getting up is extremely important, and sitting in one place to be avoided at all times. It is not the desk job per se. It is how you do your job that's more important. So keep getting up, and as I just mentioned, using big monitors, etc., regular physical activity, playing games and sports, and being healthy lifestyles will certainly help people who are who are stuck to their computers from morning till late evening. So that's what you should be doing. Thank you for your patient listening to this topic today. And I thank the audience for their questions. And we will be helping you with your queries in future too on our programs. Thank you for watching.